This video describes the application's configuration for procedure groups and procedure steps. Navigate to the Settings, Procedure tab. Here you see the default procedure groups and associated procedure codes CPT defaults. You can sort procedure codes numerically, or you can sort procedure groups alphabetically. Select the to-view left ankle to edit your customer's procedure code, and thus to populate the AP and lateral view sequence upon patient registration. Similarly, for the 3-view ankle, we have the AP, oblique, and lateral. The Add button allows you to add additional views to the procedure. In this case, another ankle oblique. The up-down buttons allow you to sequence the acquisitions. You can also delete views. So for this 3-view ankle procedure group, we see the prescribed procedure views or steps. The Step tab is where imaging parameters are specified. The HS1 and HS2 are for older technologies. HS4 is our flat panel DR default. The Label tab is where we define the target exposure index, as well as some flip and rotate defaults and whether auto crop is turned on or turned off. The Console tab is for pre-programming the generator techniques for KVP, mass, MA, and milliseconds, AEC on and off, and the field selection, as well as the default detector. Exploding the step list and exploding the ankle body part, for example, we see the available views AP, lateral, and oblique. Exploding the AP view, we see the patient size modifiers. For each size, the HS4, the Label tab, and the Console tab parameters are individually pre-programmed, although in some cases may be exactly the same. Note for the large patient, ankle AP, for gadolinium panel, we have 65 kVp at 6 mass. For the medium-sized patient, 60 kVp at 3 mass, and the small patient, 55 kVp at 2 mass. And for all of those are defaulted to the tabletop mode. Note the exposure index for the gadolinium panel is defaulted to 1300, applies to all extremities. For spine, we have an 1100 gadolinium default. For chest, exposure index at 900. We can explode this chest body part to the PA view to see a flip and rotate example. For the medium patient, we can see the technique of 117 kVp, 10 mass, but with AEC defaulted to on with the outside chambers, and obviously set to the wall mode default. Now if we browse to the System Generator tab, this is where workspace mapping is accomplished, where the detector or detectors are defaulted to either the wall, table, or tabletop mode. If you have multiple detectors, a pull-down list will be shown to choose from.